Coronary heart disease is a condition in which the arteries supplying blood to the heart become narrowed by the buildup of fatty deposits, leading to insufficient blood flow to the heart muscle. This process, known as atherosclerosis, is primarily triggered by abnormal lipid metabolism. Cholesterol and other fats accumulate on the inner walls of the coronary arteries, gradually forming plaque that reduces the blood vessel's diameter. As the narrowing progresses, the heart does not receive enough oxygen-rich blood, which can result in chest tightness, pain, fatigue, and shortness of breath. In recent years, changes in lifestyle and dietary habits have contributed to a noticeable rise in coronary heart disease cases, even among younger adults. For every patient, understanding the root causes and learning how to manage the disease through lifestyle and dietary modifications is essential. 1. Causes and risks of coronary heart disease. Inherited factors and family history. Genetic predisposition plays a significant role in the development of coronary heart disease. Individuals with a family history of heart troubles face considerably higher risks. For example, Mr. John Anderson's parents both suffered from heart disease, prompting him to educate himself about cardiovascular health from his early middle age. As people age, no matter their gender, the elasticity of blood vessels declines, making them more susceptible to damage and plaque formation. Studies show that individuals with a family history of heart disease are at least twice as likely to develop the condition compared to those without such a history. This statistic underscores the importance of early prevention and regular health screenings. Lifestyle habits and environmental stress. Beyond genetic factors, unfavorable lifestyle behaviors and chronic stress are key contributors to coronary heart disease. Conditions such as high blood pressure, diabetes, and high cholesterol add extra strain on the heart while actively promoting the narrowing of arteries. For instance, long-term consumption of deep-fried foods, sugary treats, and fast food can cause a rapid rise in blood cholesterol levels, leading to vascular damage. Moreover, smoking and prolonged alcohol consumption further impair vascular function. Take Mrs. Emily Carter as an example. Her long work hours and constant stress led to irregular sleep patterns and erratic eating habits, which in turn resulted in elevated blood pressure and diminished heart health. Fortunately, although these risk factors seem daunting, lifestyle modifications can significantly reduce the likelihood of developing coronary heart disease. Emotional stress and mental burden. Unstable emotions, anxiety, and prolonged stress can trigger inflammatory responses within the body and even cause blood vessels to constrict, further reducing oxygen supply to the heart. Research indicates that chronic irritability and depression can accelerate the progression of arterial hardening. In our fast-paced modern society, many seniors experience information overload and constant pressure, making effective stress management indispensable for maintaining heart health. Learning coping strategies and finding ways to relax are crucial steps in preventing the onset of coronary heart disease. 2. Healthy eating, building a strong foundation for your heart. According to guidelines from international health organizations, patients with coronary heart disease should adhere to a diet based on low calories, low fat, low sugar, low salt, high fiber, and high vitamins. Here are some specific recommendations to help fortify your heart. 1. Control calorie and fat intake. It is important to reduce the intake of animal fats and foods high in saturated fat. Avoid excessive consumption of red meat, fatty cuts, and organ meats. Instead, choose lean meat options such as skinless chicken breast and lean beef. For example, a daily serving of 2 to 3 ounces, approximately 50 to 75 grams, of lean meat is ideal. Incorporate more plant-based oils, such as olive oil or canola oil, which are rich in unsaturated fatty acids known to protect the heart. 2. Limit salt and sugar. To prevent spikes in blood pressure and the formation of arterial plaque, patients should minimize their salt and added sugar intake. When cooking, consider adding salt at the very end or using natural flavor enhancers like vinegar or lemon juice as substitutes. Also, avoid sugary beverages, processed snacks, and convenience foods that pack excess sugar. These steps will help maintain stable blood pressure and reduce the risk of further vascular damage. 3. Increase dietary fiber and quality protein. Adequate dietary fiber can help lower cholesterol and stabilize blood sugar levels. Aim to eat whole grains, oats, and brown rice regularly, along with a variety of fresh vegetables and fruits such as spinach, carrots, tomatoes, apples, and bananas. Additionally, plant-based proteins like tofu, soy milk, and other legume products are excellent sources of nutrition. For dairy, opt for low-fat or fat-free options, keeping the daily intake around 1 to 2 cups, 250 to 500 milliliters. These measures ensure balanced nutrition while protecting the cardiovascular system. 4. Combine fish and nuts in your diet. Moderate consumption of fish, such as salmon or cod, which are high in omega-3 fatty acids, can help improve blood circulation and reduce inflammation. Aim for 2 to 3 servings of fish per week, around 3.5 ounces or 100 grams per serving. Additionally, nuts like almonds and walnuts offer heart-healthy fats. However, be mindful of portion sizes to prevent excessive calorie intake. The right balance of these foods supports heart function and prevents plaque buildup. 3. Regular exercise, strengthening your heart's protective barrier. An active lifestyle is a vital component of overall heart health. Coronary heart disease patients should work with their healthcare provider to develop a personalized exercise plan that gradually improves cardiovascular fitness. 1. Aerobic exercise. Engage in moderate-intensity aerobic activities such as brisk walking, jogging, cycling, or swimming. Aim for 3 to 5 sessions per week, starting with short durations of about 10 minutes and progressively increasing to 30 minutes or more per session. This steady approach not only supports weight management but also enhances blood circulation and overall metabolic health. For instance, Mr. David Miller began taking 20-minute morning walks and soon noted that his blood pressure had become more stable and his energy levels had risen. 2. Flexibility and strength training. In addition to aerobic activities, incorporate flexibility exercises and light resistance training, such as yoga, Pilates, or Tai Chi. These exercises can improve balance and strengthen muscles, reducing the risk of falls. Mrs. Sarah Johnson, once hesitant to exercise because she feared injury, took up a gentle yoga class after consulting with her physical therapist. Over time, she experienced improved strength, a more stable mood, and overall better heart function. 4. The importance of quality sleep and emotional well-being. A robust heart requires both adequate rest and emotional balance. 1. Establish a consistent sleep schedule. Aim to secure about 8 hours of sleep per night. A regular sleep schedule, notably retiring before 11 p.m. and waking up at a consistent time, helps the body repair itself, regulate hormones, and maintain steady blood pressure. A well-established circadian rhythm can significantly reduce the fluctuations often linked to heart conditions. 2. Practice stress relief and emotional support. Facing daily stress with effective coping methods is essential for maintaining cardiovascular wellness. Engage in activities that ease stress, such as reading, listening to favorite music, meditating, or chatting with friends and family. Mrs. Rebecca Thompson, who once struggled with anxiety due to a demanding work schedule, found community support groups and mindfulness exercises helpful in reducing her stress levels. With improved mood and reduced inflammatory responses, her heart health remitted measurably. 5. Medication management and regular health monitoring. Although lifestyle modifications are the cornerstone of heart disease prevention, some patients may also require medication adjustments under professional supervision. 1. Principles of medication treatment. Patients with conditions like high blood pressure, high cholesterol, or diabetes must adhere to prescribed medications diligently and undergo regular checkups to monitor the effects. Overdosing or improper medication use can further increase the burden on the heart. For example, Mr. Michael Davis, diagnosed with high cholesterol, adjusted his dosage based on frequent lab tests and saw his cholesterol levels gradually normalize. Working closely with healthcare providers ensures that medications are optimized to support rather than hinder heart health. 2. Regular checkups and self-monitoring. Ideally, a comprehensive medical evaluation should be conducted at least once a year, with a focus on monitoring cholesterol, blood sugar, and blood pressure levels. Early detection of abnormal readings can lead to timely modifications in diet, exercise, or medications, significantly reducing the risk of heart disease progression. Additionally, home monitoring devices such as blood pressure monitors and glucose meters can be valuable tools for daily self-management. VI. Comprehensive intervention, protecting your heart in every detail. Prevention and management of coronary heart disease require a multi-pronged approach that goes beyond diet, exercise, and medication alone. Paying attention to the finer details of daily life can also make a significant difference. Emotional well-being, participate in community groups, pursue hobbies, and maintain social connections to alleviate feelings of loneliness and anxiety. Healthy cooking techniques, favor cooking methods like steaming, boiling, or slow cooking rather than frying. Use natural seasonings such as lemon juice, garlic, or fresh herbs to enhance flavor without relying on excessive salt. Environment matters. Ensure that your living and working spaces are clean, organized, and stress-free. A comfortable environment can lower overall stress levels and improve quality of life. Coronary heart disease is not an irreversible fate but a chronic condition that can be effectively managed through scientific adjustments and lifestyle improvements. By understanding your personal risk factors and adopting a diet that is low in fat, sugar, and salt while rich in fiber and essential vitamins, you can build a strong defense for your heart. When paired with regular aerobic exercise, quality sleep, and sound emotional management, these lifestyle changes create a robust barrier against coronary heart disease. Starting today, pay careful attention to every healthy bite of food, every consistent step in your exercise routine, and every moment of relaxation. When you weave these heart-healthy practices into your everyday life, you pave the way toward long-term cardiovascular well-being and a more vibrant, active future. With guidance from healthcare professionals and a commitment to change, every individual can transform their heart health into a source of renewed energy and hope. May all patients embrace a proactive approach to managing their condition, one that not only controls the disease but also enriches life with vitality and confidence. Stay dedicated, make informed decisions, and enjoy the rewards of a heart protected by intelligent, holistic care.